I'm Dr. Gladys Robinson, Executive Director of Piedmont Health Services and Sickle Cell Agency. Piedmont Health Services and Sickle Cell Agency began in 1970 as Triad Sickle Cell Anemia Foundation and was the first agency in our state providing sickle cell services. Over 44 years, Piedmont Health Services and Sickle Cell Agency has evolved from providing sickle cell services only to offering minority health services, including HIV and AIDS outreach, education, and testing. Triad Baby Love Plus, which focuses on decreasing infant mortality amongst infants of low-income African American women, and wellness services as breast and prostate cancer and diabetes. The mission of Piedmont Health Services and Sickle Cell Agency is to provide outreach, education, and case management for minority health disparities. Piedmont Health Services and Sickle Cell Agency serves individuals in 7 counties of North Carolina. Those include Alamance, Caswell, Randolph, Rockingham, Forsyth, Guilford, and Mecklenburg counties. Offices are found in Greensboro, High Point, Winston-Salem, Burlington, and Charlotte. Sickle cell disease is a group of inherited red blood cell disorders. Usually, red blood cells are round and pliable and move through the blood vessels easily. However, with sickle cell disease, the cells lose their oxygen, become sickle or banana-shaped, and as they move through the blood vessels, they may stick or become clumped. This often causes pain, called pain episodes or crises, may cause severe damage to organs and even stroke. Sickle cell disease affects 1 in every 375 African Americans, 1 in every 1,500 Hispanics, and persons from Asia, Southeast Asian, or the Mediterranean areas. Sickle cell trait is not a disease. In any setting, 1 in every 11 African Americans may have sickle cell trait. If an individual with sickle cell trait has a partner who has sickle cell trait, it means that with every birth, there's a 25% chance that the baby could have sickle cell disease. Therefore, it's very important that you be tested and others. Have you been tested for sickle cell trait or disease? Do you know your health status? Do you know someone who has sickle cell trait or disease?
My name is Monica Summers. I'm the parent of 2 children with sickle cell disease. I'm also the program director and camp director for Piedmont Health Services and Sickle Cell Agency. When I learned of the diagnosis of my children, I was indeed devastated. But I learned I had to turn the devastation into acceptance. I accepted the fact that sickle cell disease was not my children. Sickle cell disease is a condition in which they were born with, but that's not who they are. I had to learn all I could about the disease and how it may or may not affect them. I then began to educate myself, my spouse, my family members, and my church members on sickle cell disease and how it may or may not affect them. Sickle cell disease does not define who my children are. I became a proactive parent instead of a reactive parent. I dress them for the weather, I make sure they stay well hydrated, and I give them their medications and they rest when they need to.
I have sickle cell, but sickle cell doesn't have me.
Very grateful for the Sickle Cell Disease Association of the Piedmont and Piedmont Health Services and Sickle Cell Agency. Jasmine, my daughter, has the severest form of sickle cell disease, and very grateful for them connecting us with Duke. She's been a patient there and associated with this agency for many years now.
Hi, I'm Mike Kearney, President of the Piedmont Health Services and Sickle Cell Agency's Board of Directors, and I'm also on the management team at Timco Aviation Services here in Greensboro, North Carolina. I'd like to talk to you today about sickle cell disease and how I first became involved. A few years ago, some friends of mine had disclosed to me a very intimate story in which case they had lost 2 children to sickle cell disease. I realized that there was a lot of pain involved with the treatment and just the whole process of dealing with children that have sickle cell. A few years later, I had the opportunity to join the Piedmont Health Services Board of Directors and later on become the president of the agency. Today I'm asking for your help to help us provide services to over 1,400 patients in the 7 different counties that we serve. We need your help in the way of donations, volunteerism, community fundraisers, health fairs, and even mentoring to teens. Please visit www.piedmonthealthservices.org to make your contributions or to find out more information about sickle cell disease. Thank you very much.